Hi, Dr. Ayers. Thank you so much for being part of our Douglas Physician Mentoring Initiative. Dr. Ayers is a OBGYN here at Rutgers Robert Wood Johnson Medical School, and she will be participating in the first of our series for OBGYNs.
Well, Natalie, thank you very much for inviting me.
You are very welcome. So for the first question, why did you choose OBGYN? And if you could go back, would you change?
Well, that's a very good question. And sometimes people know exactly what kind of physician they want to. Mine was like an evolution. I didn't always want to do OBGYN, but when I had a really great mentor during my medical school rotation on OBGYN, it just kept drawing me. And I think the one aspect of OBGYN I really like is the part where I'm really providing care to women and that engagement and being involved in their lives in so many different portions of their lives during their pregnancy, that intimate thing of delivering, seeing them as they're evolving regarding going through transition of menopause. Right now, if I could just tell you a little story, I actually had a patient that I saw yesterday, and I delivered her twins 24 years ago,
Wow.
and actually was able to see her going through that transition of infertility, getting pregnant, having her babies, seeing her children grow up, actually having one of her daughters actually come to me during adolescence because she was having like really bad menstrual cramps, and to see that now she's transitioning too, regarding a transition into menopause, that 30 almost that 25-year cycle that I have with my patients. So after saying that, would I change? No. I might have done things a little differently, but you know what? That's 2020, and there's always reasons why things happen. But I wouldn't change being an OBGYN.
What an inspiring story. And it looks like there's a lot of longevity in this career as well.
It can be, but this career is also can be multiple things. You can fashion it into where you are. There are some of my colleagues who really like the surgical part of it and are just minimally invasive surgeons and do robotic surgery and laparoscopic, and they like that whole thing of taking care of women through a surgical component, giving that woman back her ability to function the way she normally did without pain or without having other complications of leaking bladder, making her quality of life improved. Then I have other of my colleagues who are really reproductive rights advocates and really feel strongly about giving women the rights to make decisions. So they have a different perspective. So I think that's one of the beauties of women's health and OBGYN. You can kind of move it into the direction where your passion is and where you feel as though that you think you can give back.
That's amazing. How long did it take for you to pay off your loans, and or are you still paying them off?
Oh, good question, especially right now where we're hearing that there's a possibility. I wish I had known that a couple of years ago. So I finished my loans when my first child started college. So
Wow.
that was 7 years ago. So it took me almost 2 decades to actually pay off my loans. And I think that is a difference. And I think it's really hard for me to be able to share my story and say that's going to happen to someone at time period that's going into medical school, because mine was a little different. I had the really very positive experience where my undergraduate degree was on scholarship.
Mhm.
So I didn't have to pay that. But then I went out of state for medical school. So going out of state, I paid much more. Looking back, I think, I understand it. And, sometimes when you're younger, your aspirations are a little different and you don't think long term. But I think if I was thinking more long term, I would stayed in state because that would have probably decreased the amount of loans that I had. And then I deferred as well during residency. And I think that has a lot to do with not having financial literacy.
Mm.
I think one of the things that I really encourage my young colleagues and also medical students is to have better financial literacy. That's not something we always teach, right? In as we're going into medical school. But I think the financial literacy would have told me to at least pay, even if a little, just the interest on those loans.
Mm.
And most likely I wouldn't have paid the large amount at the end as I did.
I love that you shared that because I feel like the financial aspect to medicine and the career is not often talked about, yet it's one of the most important parts to it. So,
Yes, because I see a lot of times there's some people who make decisions on career paths just because of that,
right.
because they have to support their already growing family, or they already had debt before they even started medical school. And I think that that's something is also being discussed in a broader aspect as well as from a national aspect. So I was really very pleased when I heard that they were going to give back. Um, for people who have loans. But there's also other options too that I don't think people already speak about, because there are also programs where individuals, after they finish medical school and residency, if they go into underserved areas, they can get relief from some of their loans, especially if they stay there more than 2 years. And those programs are out there, but sometimes are not known about. And a lot of students don't know that their availability, because maybe if they did, maybe their choice in career choice or specialty might have been a little different.
Wow, I didn't even know that. So thank you for informing me about that. Would
Mhm.
you say that your salary makes the journey worth it?
Um, I think that's a really hard question because everyone's motivated by different things.
Right.
And yes, my salary is based on what my parents made and what my family members made in the past. Yes, I can't say that I'm hurting for anything,
Mm.
that my salary does not compensate. However, I think in our field and the amount of time and energy and the sometimes stress that you go through and make sure, because you have somebody's life in your hands, right? Um, it's hard to put the money as the reason why you're doing something, because I don't think you're effective as a physician. Um, I don't think you are able to give your all to your patients. And also, it's very important, even though there's money, you also have to make sure that you take care of yourself, importantly, in order to take care of your patients. And part of taking care of yourself are you feeling gratification. I'm
Mm.
sure that there's some people who find that gratification comes from money. Other people has gratification, it comes from giving. Others, they have their own. And I think that you have to make sure you know what that is for you in order for you to say you're satisfied. Because if I was doing it only for the money, I don't think I could continue my career path the way I had. Yeah.
Thank you for sharing that. How was your journey through medical school?
My journey through medical school was I pretty much went through high school, then undergrad, and straight into medical school, and then to my residency. I had no breaks. Um, it was a little challenging in the sense that I had a lot of outside family issues that occurred during my medical school career, and I think that impacted me in at that time I thought in a negative way, but in a very positive way, because I think it molded me into the physician that I am. I lost my mom um, right before I graduated from medical school.
Mhm.
So I wasn't even going to walk. And the way that she passed was that she had a medical error. So it was very hard for me to balance that, right? But I think from that experience, it gave me a more dedication and awareness of my role. Just because someone calls me a doctor, the responsibility of that is huge, because um, I don't want to make it sound so mushy, but someone else is allowing their loved ones in my hands, right? And so their expectation of me is much higher that their loved one will be taken well care of. So I think those experiences molded me into the physician that I am right now.
It's beautiful to hear you because even through your words, I can feel your passion about what you do. And I appreciate you being just transparent with your mom, with your loss of your mom, which I'm sorry for your loss as well. But those are the things we need to hear because I feel like medicine, it's very humanistic. And yes, we can all get there if we do the work, but part of what keeps you there is just a humane part of it and knowing that you literally have someone's life in your hands.
Right. And that's why one of the pillars is professionalism. It's our clinical, especially as faculty members, our clinical skills, our research, our community outreach, and our professionalism. And I think a professionalism is also understanding. And I think when we look historically regarding medicine, people think we know so much, but we know very, very little. And yes, medicine is a science, but it's also an art, the art of healing. And you can't have I think as we are educating our colleagues, medical students, we have to remember that it is an art of healing, but also it's science, and we continue to learn. It's a life long learning process, because what I knew when I was a medical student or when I was a resident, 25% of that has totally changed. Sometimes 100% of what I did as a medical student, I no longer do, because now you're having innovations and you're finding out things, and research has found that, this maybe what we did before wasn't the best way we could do it, but that was the best way we knew at that time. So having that curiosity, um, um, curiosity and questioning is really important as being a physician, and also having the openness to make change, because we know we have to change all the time.
Yeah, that's so true. You previously mentioned that you went straight through from undergraduate to medical school. I also went straight through as well, but I know a lot of pre-medical students often question, should I take a gap year? What should I do in my gap year? So based on your experience and what you've seen with residents and even medical students, would you suggest a pre-med student taking a gap year? Why or why not?
I think that the gap year is 50-50. I think it's a great idea. And I also think it's a great idea if you go through. The positive thing about the gap year, I think it's allows, we've seen more medical students that have more emotional maturity because they've had outside experiences that then they bring to the table when it comes to medical school. And I think that also helps them in certain other situations that they might come across when they're dealing with patients. So I think we have, as faculty, seen that alternate route has really enriched our medical school class. And I think having both has made our medical school class much richer and much more vibrant group of learners, than just having everyone just coming in, or just having everybody using a gap year. But I think there's nothing wrong with a gap year. I think the gap year, though, should be something that is important to you, not important to your application.
Hmm.
So I think I think, other people, that's just my opinion, everyone who's listening to that's my opinion. But I think it's important to you, because I think when you're interviewing, we can see passion, we can see dedication, we can see drive by if it's something that you really, really feel um, confident about, versus something you do because you just think you needed to do for your application. So, for example, we had a really an interesting person who interviewed with us, who took a gap year and went to Europe to actually train as a ballerina for 1 year, because she really loved to dance and she just wanted that opportunity to reach that level. And she had gotten this opportunity before when she was in college, but she delayed it. And they delayed it for her. So she took her gap year to go for that 1 year. And she came back and went to medical school. People will say, well, what did that have to do with medicine? Well, it had a lot to do with stamina, foresight, and completing something. and that experience for her was very, very important. It motivated her regarding who she is as a person, which is really important. And I'm not saying it's not a bad thing if you go and do research with a colleague, or you go and work in a um, office of a physician. That's okay too. But if you do that office of physician, I'd probably be more interested in what you do on your off time.
Yeah.
What did you do? What are your interests? How did you satisfy that? Because as physicians, and making us well-rounded, if you're only doing medicine and don't have any outside, we're finding out that that doesn't make you very well-rounded or healthy individual. And especially during COVID, we looked at burnout of our colleagues, and we're seeing that one of the things we're encouraging our colleagues, and myself included, is to have outside activities along with the dedication to medicine.
Thank you for sharing that. As a pre-medical student, did you face any challenges pursuing this route of medicine?
I think, yes, we all have challenges, and I can say, yes, I had challenges. I think one of my challenges was initially feeling as though I was not good enough, that I really didn't get here on my own merit. Um, I went to Temple University, and our class had the largest minority class that they ever took, and I think probably they ever. I think our class is still the largest class. There was 46 of us, minorities in our class, and it just happened that way. But through that experience, by having others that looked like me and also had similar experiences in that environment, I think was very helpful. And I got to see that, I had people who, when I was studying, our study groups were diverse. And if my study partner Agnes had problems with that anatomy, I might have known that part of the anatomy could help her. And I started gaining my confidence, probably my second year of medical school. My first year was a real struggle. I felt like an imposter. I definitely had that imposter syndrome. And it happened to me again, probably my first year residency, because I was I had many people who were in my class as residents were also my classmates, but my attendings, there was no one who looked like me.
Yeah, imposter syndrome is so prevalent, especially as a first-year medical student, when you're a first-year medical student. So I appreciate you sharing that, because even for pre-medical students, it's really important to just start believing like you got here for a reason, So I appreciate you sharing that.
Yeah, and I think people need to understand that no one just allows someone to get into medical school.
It's not by accident.
It's not by accident. We're just not, giving you a pass. You got there for a reason. We saw something in you. We felt as though that you could succeed. We don't invite you to be part of our medical school class if we don't think that you can succeed. So I think part of the first year is almost more of the detriment of the student themselves, of thinking that they're not good enough, because everyone needs help. And I think one of the things that really is not stated more enough is that we expect people to ask for help.
Right.
The students think we don't, if they ask for help, that we think that they are weak and they're not worthy. But we expect that because we know that the amount of information that we're giving you guys are so vast that to navigate that, you're going to need help to see, what works for you.
From my experience, I couldn't agree more. So what is a common mistake you see pre-medical students make?
Not dreaming, settling. I always tell people, when you're making application processes, to what is your dream school? And they look at me like, what does that mean? What is your dream school? And I really think you should have two dream schools. It'd be like the place you really would like to be no matter what. And you should put it on your list. And you can have your safety too, but I think we need to, you need to dream. You need to think about what you really, really want, because you would be amazed that maybe you have a chance that you might get that dream. But I think the worst possibility is not to even reach for it, because then you'll never know if you could have gotten it.
What are the top 3 things you would say to look for in someone's dream school?
I think the top three would be really difficult. I think one of the things you have to know yourself. Some people might say that the location is really important to them because of family reasons. So they would have a dream school, but they would prefer one school over another because it's in a certain location, especially individuals who maybe have already have small children, right? So they would think that they were on top, cloud nine if they could be in a place where their children's not moved into a different school.
Right.
Someone might say that they already know what specialty they want to have, which I tell people to be very careful about that. But they might know specialty, and they might know that that they have heard about this expert, that this person, they would love to do research with them, and that might be their dream school. So I think you really need to know who you are. I think when it's very hard to get out of that phase, because that's more of like when you were in high school or going, you do to get in college. But I think you have to sit back and say, who am I? What's important to me? And then see if that dream school fits with your priorities, what you value.
Right, that makes sense. And for our last question, what is one piece of advice you could give to our pre-medical students?
The one advice I would say is to ask a lot of questions. This is a time to explore. It's a time to be able to, question yourself regarding what's important to you, but also find different people who are doing different things, because medicine is very diverse. And I think it's not one size fits all. And sometimes if you find something and you look into it and you're like, oh, really, I really thought I wanted to do that, but now I don't, that's okay. Because there's other things that you can explore. And especially with the evolution of medicine right now, now we're even using robots to be part of our clinical team, right? We have people who do pharmacokinetics in women, who are cardiologists, who just want to see how women and their medications they can make women better with different medications for their heart disease. So we're seeing people to taking medicine to a different level and collaborating with other people too, even the arts. So, like, we have our psychiatrist who is into taking and doing productions to explain different mental health illnesses with the students, right? So there's so many different things you can do. I think knowing yourself and then start exploring.
Well, Dr. Ayers, I'm continuously in awe of you. And I know just from this interview, I'm inspired. Even though it wasn't for me, I'm truly inspired, and all who are watching, pre-medical students and even parents, will also be inspired as well. So thank you for your willingness to help students achieve their dreams and go into medical school or any healthcare career.
Well, thank you very much. And thank you for asking me. This has really been my honor.
Absolutely.